We've talked a lot about just how many people use artificial intelligence tools for advice and even emotional support. But according to new research, this is something that doctors should be discussing with their patients as well. Our 9 News parenting expert, Dr. Cheryl Ziegler, joins us now to talk about it. Thanks for coming in.
Thanks for having me.
So why are experts so concerned about people using AI for mental health support?
Yeah, we know that people are going to AI for 2 main reasons. One of them is emotional just connection, just to feel like they're dealing with the loneliness. They've got somebody, it feels like, to bounce ideas off of and just be in communication with. And then 2, they're really going there for therapy, mental health advice, but also going into actual therapy. What should I do? How should I handle this? And so this is now, the top reasons people are on there. So we all have to be very, very aware of what's happening.
I feel like we normally talk about our viewers and what they should do for certain situations like this. But I do want to ask about therapists. What does the research suggest that therapists do in regards to their patients using AI?
So I love this new report. It was in JAMA. There were some recommendations in November from the American Psychological Association. And it's saying basically we all have an intake form and we ask a lot of questions. And a lot of them should be pretty standard across no matter who you see. And they're basically recommending this should be a standard question. So we should be asking our patients, what kind of interactions do you have with artificial intelligence? And can you tell me some of the questions that you kind of normally ask it? And honestly, I need to update my own forms. I don't always ask this question. Whether I'm working with a kid or an adult, I'm going to update my own forms.
Because their answers could really, as a therapist, suggest to you how often they're using it, what specifically they're struggling with if you're just asking that one question.
Absolutely. We know, we all really know, it is easier to ask a chatbot,
Yes, sure.
whatever the most to you embarrassing questions might be or things you just don't want to share with anybody at all. So I think just simply asking the question of a patient gets them in the mode of okay, maybe I need to tell you that I've been asking it this or I've been talking to it this way. And we know that when I said companionship, we know that people are even feeling like this AI bot is either their best friend or even that they're in a romantic relationship with it. So those are the kinds of questions that are new for us as therapists, but that we really do need to embrace.
Wild.
Have you used ChatGPT or a bot with any sort of personal issue?
No.
I have a couple of times.
Okay.
And I'm not getting into it because I don't want to waste time, but it's crazy how the last time I asked it about something, it gave me an answer and it made a reference to something I said to it months ago.
Whoa.
Yes.
It's oh, you mentioned earlier. I'm earlier? That was months ago.
Yes.
So it is wild how the bot could remember things better than your own therapist.
Yes.
But back to the topic at hand. What is the potential benefit, I guess, of mentioning this to your therapist? Hey, I'm doing this in addition to seeing you.
So here's the benefit, and even just using your example, what the AI bot does, if you are ever really interacting, I'm on AI every single day, it is very appeasing. It is very that's a great idea, Corey. Oh, you're on the right track, Corey. It's constantly praising you. And when we're in therapy, we are not constantly praising our patients. In fact, what we're doing is we're challenging them. We're challenging them to think differently or maybe behave differently. And AI bots are absolutely not set up to do that. So while at first, if you ask it a simple question, Corey, you really could do this this morning. Hey, I'm having a stressful day. What do you think I should do when I get off this afternoon? It's probably going to give you great advice. It's probably going to tell you to take a walk, listen to music. It's going to great advice. Let's just say though, you kept going and going and going and you were going down some destructive behaviors or something. It's not really going to challenge that. It's going to be extremely gentle and it's going to keep praising you, which keeps us coming back because that feels good. So I really want people to know, although it can give good advice, it is not at all a replacement for what actual therapy is like.
It's not the end all be all.
No.
It's so interesting because I feel like it can be used in moderation with supplementing, from the therapist, because I get it. Going to someone can be expensive. It can be time consuming. You don't have a million opportunities to go under your insurance or whatever it may be. But let's say one of your clients comes to you and you ask them that question. They say, yes, I'm using it all the time. What is your advice for them?
So first, I would really want to get into it around like, so, share with me some of the questions. One of the suggestions I even read was like, can you print off some of your interactions because they're saved and bring it in and we can go through it together. That would be really quite innovative. And I would love to do that with somebody because I'd say, that's great advice and that's great advice. And look over here, look at this missed opportunity. Here's where I would have asked you to do, X, Y, or Z. And it shared for you to do this and this. And so that people can see it's great for like a tip. It's like a tip and trick kind of thing. But really in-depth processing is still a very human interaction, and that can't be replaced.
But you have seen like an uptick in all this in the last few months, even in your practice.
A major uptick, major. For me, more so among kids. And maybe because, again, I'm not necessarily asking it on a form, but I am verbally talking to them about it. Like now when I ask them about social media, that's a standard question. I just now ask about AI, but I haven't been asking the parents or the adults as much. So it was like, ding, 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 I'm gonna start adding that piece. But yes, kids, teens, tweens, they're using AI from everything from helping them with studying for a test and creating study guides to what do I do about my boyfriend? How do I break up with a girlfriend? And again, suicide. We talked about that a few weeks ago, how much people are asking it. 800,000 inquiries a week around just anything to do with suicide. So this has arrived, and we all, including professionals, really need to get up to speed.
It's very scary. AI is everywhere. All right, interesting this morning. Dr. Cheryl Ziegler, thank you.
Thanks for having me.